Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fauzi bin Muhyiddin. Today I want to present the patient assessment and management of a patient with mental health problem of schizophrenia for subject Nbcp 3912 clinical practice mental health. Introduction: The World Health Organization (WHO) defines mental health as the capacity to experience well-being in all aspects of life, including but not limited to engaging in meaningful activities, being resilient in the face of adversity, being able to carry out one's duties effectively, and making positive contribution to one's individual and societal communities. A shift in an individual's behavior may also be an indication that a person is struggling with issues related to their mental health. Symptoms such as sleep difficulties, loss of appetite, feelings of isolation, inability to concentrate while working, excessive guilt, and a lack of self-worth are among the most prominent indicators. A person's behavior can indicate the general public or a close relative whether they are suffering from a severe mental health issue. A growing number of people, especially women, are dealing with mental illness, which is a major problem in public health. Breslin et al. 2022. Environmental factors and hereditary factors are the two main causes of mental health issues. There are two types of effective on an individual genetics, which have to do with their personality and hereditary, while environmental factors, which include things like social and financial difficulties, terrible life and relationship problems. People with schizophrenia have trouble controlling their thoughts, emotions, and actions. It can be upsetting for everyone involved when a person with schizophrenia acts as if they have no connection to reality. Schizophrenia symptoms can make it hard to do everyday things, but there are therapies that work. It is common for patients to regain their independence, participate in meaningful relationships, and return to school or the workforce after receiving treatment. The frequency and severity of psychotic symptoms can be reduced with the use of antipsychotic medication. Antipsychotic drug responses vary from person to person. Notifying a healthcare professional or any adverse effect is crucial. Through so through psychosocial therapy, individuals are supported in overcoming daily obstacles and effectively managing symptoms, all while engaging in daily activities such as school, job, and relationship building. It is common practice to combine these treatments with psychotic medication. Regular psychosocial treatment reduces the likelihood of symptoms recurrence and hospitalization. Demographic data and general health history. The patient grew up in Taman Kota Masai and she is the eldest of two siblings. In addition to the in addition to the three bedrooms and two attics, the house also features some basic furnishing, a refrigerator, manual washing machine. The infrastructure for water and electricity is adequate. Her mother is a housewife while her father is a retired soldier who now works as a security guard. Her father serves in the military. The monthly salary of her father is approximately 2,000 ringgit. From what I can tell throughout the patient's early years, she came from a modest home and her parents provide for all of their needs, including clothing, food, and school materials. The patient's father pays for everything, and the patient's brother doesn't have a job. After their mother passed away, their father took them in as the only two siblings still living at home. The patient's mother and father, as well as the patient's brother and sister, do not suffer from any form of mental disease. In addition, the patient indicated that neither the father of the parents nor the cousin had any kinds of mental health issues. Miss A is a 30 years old Malay woman diagnosed with schizophrenia. The patient began therapy for his mental condition at Clinic Kesihatan Masai when she was 20 years old, and she continued his care at Hospital Permai after that. The patient reported chronic fatigue 1 month before the two admission. The patient is unable to focus on her everyday tasks and has lost interest in working. Back then, Miss A tended to stay in her room where she could watch TV and sleep all day. Along with that, the patient claimed to have overheard a woman remark, "Don't eat and don't sleep, which indicate the auditory hallucination. The patient's father claims that his daughter has mood swings, being angry and crying while conversing or laughing alone for as long as a month. Since the patient had trouble sleeping for 2 weeks due to the increasing frequency of the woman's voice, her depression worsened in the 2 weeks leading up to admission. It has been reported by the patient's father that the patient frequently observed herself chatting with herself. Additionally, the patient experiences a persecutive delusion when she experiences intense fear due to the belief that someone is seeing her and intend to harm her. Miss A also has a delusion of unworthiness which she believes her existence has no purpose and is meaningless. The patient's condition is deteriorating rapidly. Her ability to self-manage is becoming more conscious and it has been 3 days since she showered. Miss A began experiencing trouble sleeping 1 week before to admission and was only able to get 3 hours of midday sleep. Patients refuse to associate with family members and treat hearing hallucination. The patient is just the patient is just isolating herself and locked up in the room. Upon hospitalization, the patient started to experience anxiety, which manifested as argument with her brother and aggressive behavior involving the throwing of cups, plates, and chairs. This severe mental disorder is characterized by significant abnormalities in cognition, perception, behavior, and emotion. Shanko et al. 2023. Due to the patient's worsening health, his father brought her to the hospital Permai in Johor Bahru. She spent a month receiving treatment in ward. The patient was diagnosed with schizophrenia and prescribed tab aripiprazole 30 mg on morning and tab epilim 200 mg on night. Patient has no history of medical and surgical illness. Miss A states that she does not smoke. Miss A also reports no substance use and she states that she have no knowledge of any criminal proceedings. Next, assessment findings. As a reference for this case study, I look up the following criteria for schizophrenia in the Diagnostic and Statistical Manual of Mental Disorder, DSM-5, published by the American Psychiatry Association. A. The manifestation of at least two of the following symptoms for at least 1 month or less if treated successfully. One of them must be 1, 2, or 3. Patient met all the 3 of the following criteria A upon her initial admission to the hospital per month. First, number 1, delusion, persecutorial delusion. The patient is experiencing a persecutorial delusion in which the patient is experiencing strong feelings of fear because she believes that someone has been monitoring her and intending to hurt her for the past month. The patient also has a delusion of worthlessness, which means that she believes that she are worthless and useless. The patient is experiencing secondary auditory hallucination in which a woman's voice instructs her not to eat and not to sleep. Then, number 2, disorganized speech, incoherent and irrelevant. Miss A speaks in a lower volume and sometimes speaks irrelevant information for the past 1 month. Number 3, negative symptoms, for instance, reduced outward display of emotion or aversion. Miss A exhibits negative symptoms such as anger, aggression, and a tendency to isolate herself. B. There has been a noticeable decline in functioning in areas such as self-care, interpersonal relationships, and employment since the disorder began. Similarly, when a child or adolescent first experienced symptoms, they were unable to meet goals related to academics, occupational functioning, and interactions with others. Miss A does not meet all the criteria in B since she was doing fine, just like a normal healthy person. Next, C. Indicators of a chronic illness don't go away after 6 months. Criteria B, which are similar to the criteria A, which is active phase symptoms, often include a variety of prodromal symptoms or residual symptoms and must be present for at least 1 month within 6 months or fewer if treated successfully. At the same time, this disorder's symptoms could be completely absent or include at least 2 of the A-listed symptoms. Examples of such things include peculiar perception and belief. Miss A exhibits no symptoms in criteria C. Next, D. This category does not contain schizoaffective disorder, major depressive disorder, or bipolar disorder with psychotic symptoms because this condition sometimes occur in conjunction with active phase symptoms. Miss A exhibit no symptoms in criteria D. Next, E. Physiological alteration brought on by substances such as narcotics or other drugs or other medical issues are not a part of the disease. Miss A claimed that she has not been taken any of drugs. F. Additional criteria for a diagnosis of schizophrenia in cases where a history of autism spectrum disorder or communication disorder was present in early childhood include the presence of delusions or hallucination and the occurrence of symptoms of schizophrenia within a month or less is successfully treated. Miss A does not meet all the criteria in F since she was doing fine just like a normal person. Finally, the medical officers in Hospital Permai has diagnosed Miss A as schizophrenia. Then, it has been reported by the patient's family that Miss A is unable to perform tasks related to housework, including cleaning the house, the bedroom, and managing her daily lives. Schizophrenia is a disorder that affects social and cognitive functioning, making it difficult for people with the disorder and their families to manage daily tasks like eating, dressing, and toileting. Guan et al. 2022. In addition, patients do not have the opportunity to interact socially with their families or with society. The patient also has a good insight. She is aware that she must take medication and treatment continual basis, and she is prepared to participate. Patient also have solid support from her families. They invited her to receive mental therapy at the hospital and sent her there on their own initiative. The predisposing factor that contribute to the diagnosis of schizophrenia of Miss A is the poor coping skill. Patients have a difficult time finding solution to her problem and are prone to become irritated by reacting aggressively towards her family. The patient has not married yet and does not have any close buddies. Miss A also is the victim of bullying since her primary school and makes her scared to build a trust with people surrounding. The precipitating factor that contribute to the diagnosis of schizophrenia of Miss A is that her mother passed away. Due to the passing of her mother, she have the impression that there is no place to bury her feelings. Besides that, she also always feel that she is alone and as the effect of she being bullied since she was a kid. The perpetuating factor that contribute to the diagnosis of schizophrenia Miss A is poor coping skills since she cannot think the ideal of problem solving. She also unemployed for a long time that makes her feel kind of useless. Next, the differential diagnosis for Miss A is schizoaffective disorder. Criteria and diagnosis in DSM-5. A. Non-disruption of the duration of the disease that has a major mood episode, major depressive or manic, simultaneously with criterion A schizophrenia. For 1 month, the patient's mood fluctuates widely, going from angry and crying to smiling and chatting to herself. B. Delusions or hallucination for a period of 2 weeks or more in a major mood episode, major depressive or manic, during the period of the disease. Persecutory delusion. The patient experiences persecutory delusion where the patient feels very scared because there is someone watching and wanting to hurt her for the past month. Delusion of unworthlessness. The patient has a sense of being worthless and useless. C. Symptoms that meet the criteria for a major mood episode are present in the total amount of the active period and the residual part of the disease. There is no relation in the C criteria. D. The disorder is not related to the side effects of substance, drug or medication abuse or other health problems. There are no relevance in criteria D. Next, management. Antipsychotic medication is for psychosis that can alleviate symptoms such as hallucination, delusion, and disorganized thinking by influencing brain chemistry. Additionally, they can assist in preventing the recurrence of symptoms including paranoia, hearing voices, delusions, and hallucination. Treatment of psychotic symptoms in these illnesses usually involves antipsychotic pharmaceutical administration over an extended period of time. in addition to complementary pharmacology treatments and continuous psychosocial and supportive intervention to lower mortality and morbidity rates. Noel and Jackson 2020. Feeling anxious and extreme restlessness can occur, for instance, when one feels threatened. The treatment of Miss A is as follows. Firstly, antipsychotic medication. Tab aripiprazole 30 mg on day, tab sodium valproate 400 mg on morning and 600 mg on night, tab benzoxazole or Artane in 2 mg on day. Next injection, she is been given IM fluphenazine decanoate or Modicate 37.5 mg monthly. Miss A is not on any medical medication since she got no medical illness. She is also not on plan to do ECT because no indication. Miss A also has participated in psychosocial rehabilitation, firstly interaction therapy. The goal of interaction therapy is to provide the patient with the opportunity to communicate her feelings and to establish a positive relationship with people surrounding. Next, the routine activities exercise. In order to educate patients on how to maintain everyday activities to the highest possible degree of self-hygiene care, such as bathing with soap, brushing their teeth correctly, dressing themselves when they are clean and dressed, and teaching them how to wash their hands correctly. Besides that, social skills training, its purpose is to empower patients. Empower patients by providing them with information and training as well as supportive support and assistance in managing psychiatric conditions throughout their lives. The program includes methods of controlling the illness on its own with the objective of achieving healing from severe psychiatric disorder and making progress towards living a life similar to that ordinary people. Moreover, supported employment. At the quickest feasible rate, provide assistance to patients who are seeking for jobs in the job marketplace within the community. The patient hobbies and skills are taken into consideration while selecting a job for them. When the patient requires assistance at work, the case manager will be there to provide assistance and guidance. As part of her treatment for her illness, Ms. A has also received psychoeducation and training in anger control, stress management, and behavioral therapy. Conclusion: even if the prognosis is more positive than negative, I still think that the patient has a high chance of a good long-term outcome. Given that she is only 30 years old, the patient's loved ones are there for her. Additionally, the patient demonstrated a desire to actively engage in the therapeutic process. The patient's father stays with her so she can keep an eye and there will be him for her. The patient has supportive loved ones and she has a basic insight. She understands the significance of medicine and follow treatment plan to get better, but she doesn't worry about when she has to take the medication since she relies on her father so much. In my opinion, health education can raise the patient's knowledge of this illness and the significance of medicine. Recovering from mental illness is much easier with the support of loved ones and meaningful advice. Both the individual receiving treatment and their loved ones' ability to cope with the emotional and practical demands of caring for a loved one with the schizophrenia diagnosis are essential components of recovery-oriented care, Okafor and Monahan 2023. Furthermore, patients still require psychoeducation and rehabilitation treatment on a regular basis to enhance her quality of life and learn to rely on herself less. Nowadays, the main goals of schizophrenia treatment are symptom management, daily functional improvement, and the attainment of individual life goals, including finishing school, getting a job, and having a satisfying relationship. Next is references. For this For this case study, I have found 5 references from this article. That's all from me. Thank you.